Beneath the desert sun, Egyptian healers blended ritual and reason into an art of survival that still astonishes modern medicine. In this series, we bring you the greatest medical school that the pharaohs could offer, right here, in the temple clinics of ancient Egypt. The diagnosis was a holistic experience. A priest-physician's senses would mingle to make a pronouncement. First, they'd inspect the patient, then inhale deeply, catching their scent. Next, they'd feel the radial pulse at the wrist, believing it revealed the heart's condition. Finally, they'd inquire about the disease's history, including its first symptoms and how these evolved over time. Then came the prescription, usually written in the form of a love poem to be recited daily. Remedies were simple, yet some were surprisingly modern. To fight infection, they prescribed honey, which even today is used topically to prevent wound contamination. For pain relief, they recommended willow bark, a natural source of aspirin, and if a wound was inflamed, they might prescribe mold-touched bread, a form of antibiotic. Once a year, the entire household staff would take part in the New Year's feast. This involved eating, drinking, dancing, singing, and a great deal of but this merriment frequently led to unfortunate accidents. The kitchen staff would often burn themselves while tending to the ovens, or cut off portions of their fingers while preparing food, so the physicians kept busy treating burns and setting broken bones. The tools they used for stitching flesh were rudimentary, consisting of a wooden handle and a sharp bone needle made from a deer femur, but they did have some advanced instruments, too, like curved forceps, used to extract foreign objects from wounds, and ear scoops, used to clean out earwax. For serious injuries, they developed sophisticated splints to set shattered bones. These splints consisted of two pieces of wood or metal that were bound together with leather thongs, which were then wrapped around the injured limb to immobilize it. Once set, these external fixators remained in place until the bone had healed. Today, the principle behind external fixators remains the same, but now they're made of stainless steel and are far more sophisticated. Perhaps the most dramatic procedures were those performed on the skull. When a patient presented with a head wound and a fever, the priests believed that the only cure was to open the skull and release the pressure. This may sound extreme, but it was actually a life-saving procedure that was sometimes necessary to treat head injuries. While the trepanation process varied, the standard treatment was to make an incision in the scalp and then drill a hole into the skull. The bone fragments were carefully removed, and the edges of the hole were smoothed to prevent further damage to the brain. After the operation, the opening was covered with a bandage or a piece of leather to prevent infection. Surprisingly, many patients survived the procedure and went on to live normal lives. In fact, several mummies with evidence of prior trepanation have been discovered, suggesting that the procedure was relatively safe when performed by skilled hands. One such skilled hand belonged to Imhotep, whose skills in medicine and surgery became legendary. His reputation grew so much that he was eventually elevated to the status of a god. He was credited with the discovery of the binding of tendons and ligaments as well as the use of antiseptics and the development of artificial limbs. Unfortunately, most of these claims are likely exaggerated, and there is little evidence to support them. Despite this, Imhotep remained an important figure in Egyptian culture and was worshipped as a god of medicine and healing for centuries. Egyptian society greatly valued knowledge and encouraged the sharing of information. This led to the creation of detailed anatomical illustrations that served multiple purposes. Not only were they used to educate students and record new discoveries, but they also helped priests and scholars better understand the human body. Some of these illustrations were incredibly accurate and detailed, showcasing the Egyptians' advanced understanding of human anatomy. The Edwin Smith papyrus is a prime example, containing some of the most realistic anatomical drawings ever seen. So precise were the Egyptians in their observations that they even had a word for blood types. They recognized that not all blood was the same and that transfusions could be dangerous if the wrong blood types were mixed. This groundbreaking discovery was made thousands of years before modern science confirmed the existence of different blood types, a testament to the Egyptians' keen observational skills. Their medical knowledge didn't end with the living. The Egyptians' obsession with preserving the body for the afterlife led them to develop sophisticated mummification techniques. Mummification not only kept the body intact, but also inadvertently served as an anatomy lesson. As each layer of the body was examined and treated, scribes would document their findings, adding to the collective body of medical knowledge. This extensive study of anatomy gave Egyptians insights into the workings of the human body that were centuries ahead of their time. Thanks for watching. Subscribe for more.